It's lovely to see everybody here and welcome you to this presentation of hidden talents at the start of Mental Health Awareness Week, and it's very important to us to be able to share this with you and for many people to support in that project. Please do have some nibbles on your way out if you haven't already. It's our way of saying thank you for coming, and we really do appreciate you coming out. So also take away the bits of paper that have been offered. It's been organised by Donna, who's our marvellous administrator, and she's done a marvellous task in pulling all those bits of paper together, and they are very useful bits to take with you. My name's Mike. I am Mike Oates. I'm the chaplain to Mental Health Trust in Dorset, and I'll ask my colleagues to introduce themselves.
I'm Donna Jenkins, and I'm the Recovery Education Centre Administrator for Dorset Healthcare.
Okay, I'm Sarah Clark. I'm a third-year occupational therapy student. I also work as a bank support worker.
I'm Hannah Blunt. I'm a mental health nurse, and I work between Nightingale House and the Assertive Outreach team in Bournemouth. I'm just going to give you a brief overview of why I came into Hidden Talents and what Hidden Talents means to me, and also how it kind of expands across my role as a mental health nurse. I feel privileged to work with such a fantastic spectrum of people. All my clients have something special to give society. They always show a marvellous strength in the face of dealing with experiences associated with poor mental health. Some of my clients have come through tremendous adversity on both a social and personal level, and still give me a smile at the end of my working day. Yes, there are times when work can be challenging. This is usually when I experience great empathy for the pain my clients have to go through to be in recovery. My own lived experience of emotionally unstable personality disorder has given me an understanding of this. I would never proclaim to know what an individual suffers, as we all go along our paths differently and we're all unique. What it has given me through a working understanding of using services and recognising the importance of opportunity is that it's to be able to constantly improve what we offer as a service. I firmly believe that each person I work with has given me wisdom to improve my professional development in order to provide a continually growing service. I believe my own experience of mental health has given me insight into the importance of looking at each person's care at an individual level, and understanding that mental health issues develop for a number of reasons which all need attention. Being honest about my own experiences of other staff members I think is helpful, as it breaks down the barrier of us and them. It highlights that anyone can have mental health problems and anyone can recover. I hope that it makes people think that person who I'm treating as a patient right now and needing to make decisions for could be a colleague of mine, or how would I like to treat this person if they're a friend or family member? Maybe more importantly, how would I like to be treated if I was in this situation? I've had clients say to me, "You don't understand what it's like to have this happen." I always answer, "No, I don't, but I do have struggles like anyone else, and I have faith that you can get through this." Having hope is one of the most important things you can hold for a person in mental distress, and when the light at the tunnel can sometimes be faint and hard to walk towards. I also believe one of the most important things we can do as professionals is offer our clients as much choice as possible in their care and value their expertise in their own health. I believe we can apply the customer knows best in many areas of care delivery. My own experience has taught me that feeling in control of your life when you're unwell is very important with recovery from episodes of mental distress, and being trusted in your own decision making as far as reasonably practical. Recovery is a journey, and the most important thing is being accepted for your struggles, the ups and downs, and for people to appreciate that out of a struggle brings strength and wisdom. Being human entails learning from your experience from birth to death and embracing the journey that this takes you. Thank you. So I'm going to start with talking about the Hidden Talent Project as a whole. It started in 2010 as part of a wider body of work. It was initially piloted for staff in the west of the country. The Hidden Talents booklet was produced in 2011 and used to launch the project across the whole of the Trust. And the Supporting Recovery Journeys booklet for staff was produced in 2012. Hidden talents relates to embracing the value of lived experience of staff and to contribute to the improvement of service user care. It's equally been developed to support staff with mental health needs as well. The Hidden Talents Group and associated projects has begun achieving this through a variety of mediums, which serve to increase communication regarding lived experience of staff and how this can be beneficial to services. And it is also about increasing networking of services using lived experience as a valuable resource, which will be discussed later. The project is also developing a framework by which the lived experience of staff within the group can influence services to benefit staff and service users. This includes developing values and aims of using lived experience as a valuable tool to support others and linking with health services to increase access to support and publicising the group and its work. The Hidden Talents Group encourages others with lived experience to join the group and increase the asset of the project by enriching it with further lived experience. The Hidden Talent Group and their work aim to reduce stigma regarding mental health within the workforce and inevitably promoting a more shared approach to recovery, recognising the importance of acceptance and social networks within this.
Okay, next one. Okay, the Supporting Recovery Journeys of Staff booklet was produced in 2012 by the Dorset Wellbeing and Recovery Partnership. It contains a collection of 3 papers which all address different aspects of supporting staff with their recovery journey. The response rate showed that 53% of people reported having lived experience, 37% of those have accessed a mental health service, and 30% have acted as a carer. The second paper offers a framework for using and sharing lived experience within health and social care. The paper is split into 2 parts, with the first part discussing sharing lived experience with people who access services, and the second part looks at sharing lived experience with colleagues. The project was undertaken by the Dorset Healthcare and Dorset Mental Health Forum as part of the Implementing Recovery for Organisers Change programme. 3 focus groups were set up, one which was the Hidden Talents Group, the second was representatives from different professional bodies, and the third was a group of people who access services. The focus groups not only shaped the content of and why to utilise self-disclosure, but also led us to reflect on the starting point of sharing any experience and the organisational conditions that would support this culture. Therefore, the focus of the project moved from sharing lived experience of mental illness to sharing lived experience in the broadest sense, but with a focus on trauma. The booklet goes through ways that our lived experience can be shared and the key points to consider. The third paper, Managing Stress at Work, the Wellbeing at Work tool, provides a simple, supportive way to enhance work-based conversations that focus on an individual's well-being. The document aims to give an overview of how to effectively support staff to manage stress within the workplace. The document gives a step-by-step guideline on how best to do this. Next one. Okay, thank you all for coming to listen to my story. I first began to experience mental ill health at the age of 9, where I remember taking some tablets that I found in the cupboard. It was due to childhood trauma that I experienced from the age of 7. I remember not wanting to wake up the next day. From that moment, I do remember feeling depressed as a child. At the age of 13, I had moved schools due to being bullied. My family life was difficult, and my sister going into foster care, and my mum experiencing her own mental health difficulties. I began self-harming and subsequently trying to take my own life on a number of occasions. My eating was also out of control, where I'd go through stages of starving myself and then binging and making myself sick. I remember hating my body from a young age. I hated the thought of developing into a woman. I was sexually assaulted at the age of 18, which triggered previous memories of what happened in my childhood. This was when anorexia took full force. It didn't happen overnight. It was a way to deal with everything else that was going on in my life. As I began to lose weight, it gave me control, a sense of achievement, something that I felt that I was good at. I had such intense low self-esteem, and losing weight gave me a sense of empowerment. I still remember the excitement of seeing the number go down on the scale. I was a perfectionist, and for once in my life, anorexia was something that I could be good at. It felt like my only friend, my comfort blanket. I felt that being childlike protected me from the world, where hopefully no one could hurt me like they have done before. I spent a number of years in and out of hospital, fighting the system, losing the weight, gaining the weight, dealing with my emotions, my past, through food. My last admission to an eating disorder unit at the age of 23, I knew that I couldn't go back to how things were before. I actually wanted my life back, although I wasn't quite sure what that was. I made the decision to go into supported housing. Going home back to the home environment resulted in relapse. As much as I loved my mum, our illnesses both fed off each other. I entered supported housing at still a low weight, but other things had to improve before I could begin to overcome anorexia. The supported house place I was in treated me like a person, not as an illness, as what my experience in hospital had been. They worked on what I wanted to achieve. It was the first time I thought of recovery. Previously, recovery was seen as a cure, where I had completely let go, and I couldn't imagine living without anorexia, as it had been my only coping mechanism. I began to see recovery as a way to manage my illness, do the things that are still important to me. I learned a journey of self-discovery, one of which I am still on. I began to find my own identity and begin to break free from the constraints that my illness had on me. I began to receive therapy for post-traumatic stress disorder, which has haunted me for years and had led me to cope using unhelpful coping mechanisms. It was challenging, but the supported house place gave me additional support when old memories came to resurface. I began to find ways to manage the flashbacks and memories and accept my body to develop into that of a woman. During my time in supported housing, I took up cycling. At first, I do admit it was to please my eating disorder, but I actually enjoyed it, and it was then that my illness started to take a step back. Cycling and being low weight is a recipe for disaster. I found something that I could be good at. It gave me a sense of achievement, similar to what anorexia had given me. I realised that I had become in charge of my own recovery. The occupations that I was engaging with had a positive influence on my mental health. It actually helped me to develop a more positive attitude towards my body image, and the endorphins it released helped my mood. I didn't wake up overnight and decide, today I'm going to be well. Things gradually led up to it. I began to gain my own identity. Anorexia had been my identity for so long, and I was beginning to find out who I was. I remember attending my younger sister's graduation and thinking, I need to do something with my life. Then I thought of training to be an occupational therapist. I remember the occupational therapist I met on the ward. She had been my DBT therapist and helped me to move into supported housing. When I looked into it more, I realised how my own activities of cycling had really helped my recovery. And when I think about it now, it is only now I can recognise how important it is to have routine and meaning in your life. I applied to do an access course, which was challenging, as despite the work I'd done in supported housing, I was very out of touch from normal life. Most of my teenager and adult years had been stuck inside the mental health system. I felt much institutionalised. There were people with babies, families. I felt so alone. I cried for the first few weeks, thinking I couldn't do it, but I stuck at it. I remembered how determined I was to lose weight, so I used this determination to stay well. During the year that my place to university was deferred, was the year I met my now husband. We had only been together for a month, when I ended up being sectioned and admitted to hospital due to a close friend of mine dying, and me trying to take my own life on a number of occasions. I sent him a message telling him everything about how crazy I was, expecting him to run for the hills. But despite this, he stuck by me, and is now training to be a mental health nurse. He has been tremendous support over the years, and still continues to be one. He has helped me to trust men again. He was my first relationship, and I know for certain he'll be my last. I would say, now I am in recovery, I will always be in recovery, and managing to live with mental illness. As will be explained in more details, Hidden Talents is a group for people with lived experience of mental illness and trauma who work within Dorset Healthcare. Through being part of this group, it has made me realise it's perfectly okay to experience mental illness and be able to work in mental health as an occupational therapist. I haven't always felt this to be possible. When I started uni, I kept my illness quiet due to my place being deferred because of my illness. I felt scared that if anyone knew, I would no longer be able to continue with my studies. I was scared of what people thought, how they would judge me. I wanted a new start. However, I realised that my past experiences have made me who I am today. I have something that not many people have, insight into mental illness. All my experiences have made me more insightful and given me a passion to support others. I wouldn't be training to be an occupational therapist if it wasn't just because of my own mental illness. I just want to end on a message that a friend of mine from hospital left for me last week. Your wedding was beautiful, and the photographs are all stunning. Whenever I feel scared, stubborn, when it feels like everything is just getting worse instead of better, I will look at those photos and remind myself of everything that is possible, as long as I never give up. I also need to remember that there is no quick fix, no magical way, no threshold to pass that dictates I'm recovered, but that every day has a mini medal, little steps that make me stronger and more determined not to look back, because I bet that not a moment goes by that you don't value each and every one of your mini medals and always look forward to your next one. I feel it sums up recovery. What she said was so true, and for me today, speaking out has been one of those mini medals.
Sorry,
So we're going to talk a little bit about the Hidden Talents relaunch. So the Hidden Talents was relaunched at the beginning of 2014 and meets the last Wednesday of each month.
And we seek to include both east and west of region, and we've been oscillating between Dorchester and Poole, and that may change as we grow. We seek to include social things as well, and a good curry occasionally. The first meeting we had 25 people who came together, and really the impact of that meeting is still really with us. It was a very emotional meeting in that almost intuitively people just began to share their experience of mental health without any prompting. It was what we were there for. We knew we carry this experience with us. We knew we were committed to our work, and we knew we should be able to join them together. And we felt intuitively again that we'd find a structure to do that, and Hidden Talents was the way we felt that was going to happen. And the impact was documentary level. It was really powerful in the room and then afterwards, and the momentum of that is still being carried. The group seeks to offer peer support. It is important, as we are all working in a relational field, that we give that the primary place. That putting aside all the other things we have to do as professionals, we're really there for the relationships. And if we offer each other relational support, then we can offer others relational support as well. The first meeting was emotional. Literally, it moved us. It was emotive. And that movement is still going on, and we seek to be able to endorse that every time we meet, every time we pick up the phone, send an email, see each other in the corridor. It is a bonding and an affirming experience. Since last January, we've begun to get ourselves a bit more organised, seeking to develop our aspirations and our purpose, which will be summarised possibly later on, but look towards offering support, education, and seeking a culture change. Support, education, and seeking a culture change. To that end, we've developed an action plan, which is a structured way, through the various skills that this body of people hold, and they are many and varied, of moving from the emotional and the relational maybe, towards actually putting stuff on the ground that we can translate into the structure of the trust, into education, into the wards, into the community. And how we're doing that, maybe we'll share later. We discussed a name change because we felt we didn't want this to be hidden anymore. We wanted that term to be redundant, but realistically we recognise that we're not quite there yet. So we are still calling ourselves Hidden Talent, with the hope that one day that term will be redundant.
So our aspirations. The Hidden Talents Group's aspiration is for Dorset Healthcare to recognise the value of lived experience within its workforce as an asset, to understand lived experience to be an essential ingredient in creating a learning environment which will support the well-being of all staff and improve the experience of people who access services and their carers and supporters. So that's our aspiration that we as a group have come up with now and want to work towards. I'll just elaborate a little on what we would call lived experience. This is a concept where a person has experienced a mental health condition, But lived experience can also include a trauma, bereavement, divorce, physical health conditions, and it also has an impact on family supporters and their carers, as in living the experience as well. And just an example of that, for myself, my lived experience was used as an asset to get my I've had 2 jobs within the Dorset Healthcare, and both times my mental health, my mental illness was used as an asset, which I will elaborate on shortly.
Our current developments, what we're occupying ourselves with now, is we're very much seeking to enhance organisation sign-up, which stands for itself. We want the trust to recognise and own this, simply. That's the Dorset Mental Health Trust. We are currently a self-organising group with permission, which is institutional terms for we're not quite sure about this yet. We'll stand at a distance and say all the right things, and if it proves that it's going to have legs and carry, then we'll go for it. And we're trying to give it legs and to carry within the trust. We hope that what Hidden Talent stands for will, in a sense, become what recovery has stood for in these last years, when recovery now is a very well-known concept within training and practice, and we would hope that what Hidden Talents is would have the similar profile in time to come.
We would like to think that we're improving communications, and so members of the Hidden Talents group entered into a poster campaign for the allied health professionals, which Sarah's going to elaborate on a little bit later on. But there are copies of the poster around. We've got lots of handouts as well. If you haven't got a handout of something specific, you can come and ask us, but there are copies of the poster. This was the poster that was devised by some members of the Hidden Talents group, and let's what the names of the people today. Phil Morgan, Jackie Lawson, Paul Siegenthal and Sarah.
It's got my wrong name though.
Sarah is now Sarah Clark. And as with regards to communication, I've taken on the administrator role alongside a member of the group, and we have a weekly roundup within Dorset Healthcare, which I have good links with the communications department, and we try and get the meetings out onto the intranet, onto the weekly roundup, so that any members of Dorset Healthcare can see when the next group's going to be. I think we've got some of it out in the weekly roundup for today's event. Was on the weekly roundup. There's also, if people have access to Facebook, we've just started a closed group, and I think there's a national group as well.
Yes, it's been set up.
That's been set up. So there's a lot of peer support around communication, supporting each other.
We're seeking to develop training, and we're going alongside the Recovery Education Centre. Could you just wave that brochure that's on the edge of the table, which you'll probably be all aware of. And now there is a course which is going to take place for the first time at the end of this month, Sharing Lived Experience, which will become integrated into what people are offered through the Recovery Education Centre. Another way of integrating what this is into the wider picture of how we support people with mental health problems to be who they can be.
And we're looking at building links with the Occupational Health Department. This is quite a key issue, which is it's an ongoing development, and in the very early stages we find that we want to just try and build a link for Occupational Health within the Hidden Talents group. So like I say, it's very early stages, and we're just looking at going forward with that item.
We're developing a buddy system. Now, this is a word I struggle with, to be honest. It might be my age, but I don't see myself as a buddy. I can be a good friend, I can listen, I can send emails, texts, I can probably even manage a Twitter or a Facebook. I can be there for people, I can meet them in the corridor and smile at them. I can be in the same building and know that they're in the same building, and as such, we're there for each other. If that adds up to being a buddy, then that's fine. We're seeking to develop a system whereby staff can support each other in the work they do, they're committed to, but also recognising that we experience mental health problems, and how that actually pans out, we're not quite sure, but there will be a survey made available to you for your to have a look at a little bit later on, and we're in the process of developing that system through that.
We are looking at setting up peer support groups, or we were thinking of a couple of members of the Hidden Talents group have discussed this. We did talk about breaking into East and West to cover, because obviously we cover the whole of Dorset, to cover both areas, and a couple of our group are going to come and talk about peer support, and I've also done some peer support group training myself, so have a bit of experience with how a peer support group should look, but that again is another item that we're looking into setting up, and we also offer peer support via Facebook for people that do have access, and obviously Twitter.
So Hidden Talents is a brilliant idea, but like all brilliant ideas, it just doesn't happen in one place. It tends to express itself at the same time within a culture in different places, and so we are not alone. Leeds, Norfolk and Suffolk trusts, and Oxleys and Nottingham are also pioneering this idea of hidden talents for professionals within the trust, and also Derby and Devon are very interested in pursuing this. So there's a sort of national movement, and it's worth maybe keeping an eye on that as to how it develops, and we're very much in conversation with those groups to help us on our way.
Okay, so this is me, and I'm administrator for the Recovery Education Centre. I'm going to give you my narrative. I need to speak up. Okay. I was trying to speak up a bit. Sorry. There is a booklet available that you are welcome to take with you that has our narratives in today, and it has also narratives of some members of the Hidden Talents group. So if you come and see us later, we'll give out those booklets. But this is my narrative. Is that better? Thank you. Christmas of 1998. I was 28 years old and suffering an episode of psychosis. I didn't know what was going on, neither did my family. All I knew, I was Robbie Williams' girlfriend, Mother Nature, a goddess and God, and the 20th of December I was on my way to Radio 1, aka Forston Clinic. My illness is stress related. My job and personal life were very stressful at this time, but I do believe that attending a hypnotic session and then 4 sessions of NLP, neuro-linguistic programming sessions, were the trigger. If anybody can throw any light on hypnosis or NLP to this effect, I would be grateful. I spent the next 9 years having episodes, although my insight was growing each time, and I was slowly taking control of it instead of it controlling me. My diagnosis changed from psychosis to bipolar affective disorder to my current diagnosis of schizoaffective disorder. In between each episode, I would return to work. My employers at that time were very supportive. My role when I became unwell was a social work assistant in a childcare team, but I was redeployed back into an administrative role. My hopes and dreams had been to be a social worker. I also undertook part-time youth work. I always remember as well taking a British Sign Language course whilst in recovery and passing. Relationships were a little difficult to sustain. I did get married, but unfortunately this broke down. However, I do have 2 beautiful stepdaughters and a gorgeous step-granddaughter, and do keep in touch with them and their partners. Recovery was paramount to me, and I was aided by the NSF, which was then the National Schizophrenia Fellowship, now Rethink, my CPN, regular visits to my psychiatrist, family, friends and work. I would literally bounce back. I was actually nicknamed Tigger, as I would bounce around for some strange reason. This was my manic side creeping in. I currently have been well since 2009, where a minor episode occurred, but my control kept me out of hospital. Along with medication, excellent support from my family, friends and a partner, I lead a fulfilling life, working, and I also play saxophone and sing in a band. I wanted to give something back to mental health, so applied for a post with Dorset Healthcare as a secretary to the Director of Mental Health. I didn't get that particular role, however, my lived experience was treated as an asset. It was from this day on that I was introduced to the hidden talents. I was invited back and offered another post within the Mental Health Directorate. I was in. A role became available for Recovery Education Centre Administrator. I had to have it. I applied and I got an interview, and again my lived experience was used as an asset, and I got the job where I happily remain today. To me, mental illness has been a blessing. I've met some wonderful people, interesting. I have gained insight into a world some may call crazy. I even taught an unteachable guy how to knit whilst in hospital. My psychiatrist at the time said, "Donna, how did you do that? What an achievement." I'm truly blessed. Thank you for listening.
I was raised in a loving family who moved around quite a bit when I was young. We were quite a nuclear family it might be described, and I was very close to my brother. I felt safe, loved and affirmed. However, I grew up in the 1970s, at the height of what we call the Cold War. Messages came into my safe world that there were threats, and threats way beyond anyone's imaginings, of such magnitude that most people struggled even to talk about them. These fears crept in. They flared with TV news and public information films, and the bravado of friends that I was realising I did not share. I registered my first sense of something deep, dreadful and disturbing when I was about 11. I shared my fears with my mum, and she did her best, but the worry was in and was nurtured as well as being distressing. Time and adolescence unfolded and occupied me, and perspective was gained. In my middle teens, I attended a Christian holiday week through my school. I found there friendship, a message of security, and a glimpse of a world that had at its centre a higher power than all the forces and threats that I had sensed and flown from. This newfound faith gave me a powerful context of belonging, of friendship, and a base from which to explore the world on the basis of a stronger foundation. College came, relationships both strengthening and broken, skills learnt, confidence developed, and the world looked more friendly and inviting. I became aware that I was drawn to work with people and looked for a way forward, finding ultimately that ordination to enable work from the basis of faith and with people was the best fit. In training, I was introduced to a range of views and ideas, many enhancing and confirming, some not so. On the birth of our first child, just prior to our move to my first parish, I experienced a breaking of all that I had built up to serve in my new conning work in the Church of England. My faith seemed gone. It looked ridiculous, and I saw the world as barren and empty. Empty of all the colour and beauty I had been enriched by in so many different ways prior to this. Wise voices said, just keep going. I did. Time, relationships, good listening, my wife, and being a dad saw me through, and not least the very hard work of parish life, and facing the real issues of experience which parish life brings, that of death, of birth, of crisis, of celebration, and just sheer human goodness and sheer human crapness. We moved to Poole. By now I was very familiar with the trends and fluxes and the changes in my feelings and my moods, which were constant. I was busy, a dad in a lovely family, and there were many distractions and engaging activities. Clergy should be able to cope. This was my own self-talk and that which I picked up from my church culture. I was not coping. After several close-run job moves which didn't come off, we took the decision to move. I resigned, almost unheard of in vicars in their mid-40s unless they are ill. I was pretending I wasn't. We moved house. I started training as a counsellor. My wife moved to full-time work. I visited the doctor and started medication. It was effective, and over the last 8 years or so I've been up and down, changed medication, changed back, received very helpful counselling, attended CBT, consulted a psychiatrist, and most amazing of all, found my most fulfilling role to date as chaplain to an acute mental health trust. Amidst the creativity and the space and opportunity of this role, I still experience times of depression and anxiety. In this role, I am face to face very often with myself. In the presenting symptoms and depression and anxiety of patients I sit and listen to. I spoke to my line manager and my supervisor, and they were excellent. My line manager invited me to join the therapies team in St Anne's Hospital, where I am based. I began clinical supervision and linked up with the Hidden Talents group. These three elements have removed isolation, enabled me to build relationships and share my skills and insights, as well as learn from others. As a parish priest, I was isolated and was meant to cope. As a chaplain in the Mental Health Trust, with good support, I feel included, human and affirmed, open to change, and part of a body that seeks to understand, empathise, and enable growth. I am convinced that integrating a recognition of lived experience into understanding what staff can offer, seeing it as an asset, will make our work in mental health more human, more holistic and more hopeful. An image that I have of this is, in a sense, asking Van Gogh to paint the sunflowers without the colour yellow would not result in the same enrichment the world has enjoyed over this last 150 years or so. Asking us not to share our experience of life in the deep way it has touched us will deprive the world and our profession equally, I believe. And finding a way forward to be able to do that can only be a good thing. Thank you.
Last May, myself and some others from the Hidden Talents group submitted an abstract to the Allied Health Professional Poster Conference at Dorset Healthcare, which was launched on the 30th of July at Sentinel House, which is the Trust headquarters. Some of the aims of the conference were to share good practice and create a culture of inquiry and learning. The poster that was submitted aimed to show how, through utilising the expertise of staff with lived experience of mental illness and trauma, can improve practice. It was seen as a cycle of change, where the first step is to raise awareness, which helps break down the them and us perception, which then challenges the stigma. And through challenging the stigma, it can change culture, which improves staff well-being and can improve practice. People who access services have stated when a clinician has shared their lived experience, they found it to be helpful towards their recovery. Through improving practice, it creates opportunities to enhance practice and gives a balanced understanding of academic expertise and lived experience expertise.
This is the survey that we devised just in-house, and this survey, if you're a Dorset Healthcare member of staff, then feel free to complete the survey. We have some copies here, so you can either just come and get one, or well, that's probably the best way, come and get one. But it's about the buddy system, which Mike explained a little bit about, and we just wanted to get staff's views on how it would work. So there's just 3 questions, and if you would like to complete it, to give us some, it would just help us to give us some feedback about the buddy system. Then please feel free, and if you would like to take a copy anyway, as well, please feel free to do so.